from tomorrow, any essential workers who need a test will be able to book an appointment on gov.uk themselves directly.
It was the Health Secretary's daily good news announcement from the Downing Street press conference that 10 million key workers and their families would be able to apply for coronavirus testing. What nobody was expecting was that within 2 minutes of the portal opening this morning, the home tests had gone. Father Anthony, a Catholic priest looking after his mother, went online at 3 a.m.
It's not suitable for me to drive in. I don't have a car. The nearest point is 40 miles away. I have a vulnerable person at home with carers, and I need a home test. And at 9:15 a.m. precisely, I was told, I'm sorry, but we've run out of home kits.
We are now told that there were only 5,000 home test kits available and 15,000 drive-through slots for today. It has also now emerged they were not checking that those applying for testing were actually key workers.
I was actually appalled by the lack of security. Anybody could have pretended they were a key worker. Anybody could have used a fake name or a fake postcode.
It was not an auspicious start to the relaunched test, track and trace strategy. The key, the Health Secretary says, is to lifting us out of lockdown. And aerial shots of 2 testing stations in London showed they were today virtually empty.
The site has actually been brought back up around now for more people to go and book sites. It will then close off again. More sites will become, more tests will become available tomorrow, and so on.
Following Scotland yesterday, Wales today set out the process which they will use to ease lockdown, while Downing Street remains under pressure to be more explicit about the UK-wide plans. Today, a symptom tracker developed by King's College London and now backed by all the Royal Medical Colleges announced preliminary data which shows that at least 1.9 million people in the UK currently have symptoms of Covid-19.
You can look at the map and see how many people. So there are still some hotspots here. Brentwood at the moment has the highest rate in London. We're seeing symptoms earlier than people go to hospital. So on average in our data, somewhere between 10 and 12 days is the average time from the time you first get symptoms to when someone would go to hospital. So we're very much an early warning device for what's going on in the population. And that's why it's so useful to get this data in real time.
In fact, they saw the peak on April the 1st, 5 days after lockdown and well before the official hospital data, which showed it on April the 8th. 2.6 million people are now using the tracker, and today England's Department of Health agreed to link some of them with testing. They have also been able to show that there are many more symptoms than just persistent cough and fever.
Things like sudden loss of taste, things like strange skin rashes, things like chest pain and shortness of breath that can last several weeks, even when you're no longer infectious.
Which inevitably leads to the suspicion that people are being told they don't have COVID and can go back to work just because they aren't coughing.
Now, while ministers in Westminster and the Scottish Government have not put a date on when lockdown restrictions could start to be lifted, the First Minister of Wales has said that a relaxation of some rules could start next month. Our Home Affairs correspondent Andy Davis is in Cardiff for us now. Andy, what has Mark Drakeford said?
Well, there have been plenty of announcements from him here today, Krish, including, incidentally, some immediate changes surrounding the lockdown, tightening and easing some of the existing restrictions. So from midnight tonight in Wales, it will be made clear that if you go out to the supermarket or to the GP surgery, for instance, you cannot stay out for another reason. You have to go home. In terms of easing some of the restrictions, businesses will be allowed to open on a click and collect basis, but only if they can socially distance properly. And another measure which will be amended will be for those people with some health conditions. They'll be allowed to exercise outside more than once a day, and that's for families of children with learning disabilities, learning difficulties and autism, for instance.
And what about any major shift in lockdown longer term?
Well, what they're going to adopt here is a reverse traffic light system where they're going to be red, amber, green phasing this lockdown easing of restrictions. And the First Minister today indicated that the red phase could be triggered as early as the end of this review period, so the 7th of May. And that will be, there are no specific examples of what that might entail, just that it'll be very modest changes and all tested on a cost-benefit analysis basis. That's the sort of timetable they're considering at the moment, and it'll be contingent on targets being met, such as a reduction in hospital admissions for coronavirus patients. But Mark Drakeford has been stressing today that, you know, if Wales has to take a different approach because the science supports it, it will. But by far his preference, he said, is for a common set of measures, a common timetable across the UK in order to give the wider public the clearest possible messaging.
As we move out of lockdown, the messaging is inevitably going to become a bit more complicated. Stay home, protect the NHS, save lives. It's very straightforward and simple. Stay at home, but start to do a few things. That's inevitably more complicated. And I'd rather reduce complexity by doing it alongside others.
One other thing to mention, it emerged today somehow that 84 deaths of people with coronavirus in the Betsy Cadwallader Health Board area of North Wales had not been reported to Public Health Wales until today. And the Health Board said that it had been recorded, that there'd been problems with their reporting system, which had now been fixed. But many will find it absolutely astonishing that this has happened, particularly given that it involves deaths in hospitals and at a time when data such as this is helping to shape the public health response.
Andy, thank you. Now, traffic on Britain's roads is increasing for the first time since the lockdown began. Figures from the AA suggest that people are returning to work or perhaps just growing sick of staying at home despite all restrictions remaining in force. Some factories, construction firms and shops are reopening. And as Darshna Soni found out in Nottingham, there seems to be a bit of confusion about just what constitutes an essential journey.
Whatever happened to lockdown? As a nation, it's said, one of the things we love to do on our days off is DIY. But what about when we've been off for 4 weeks? The combination of some glorious weather and the reopening of B&Q brought hundreds of people out in Nottingham today.
Do you think gardening is essential?
I personally think gardening is essential because I've got 2 kids. They need to be gardening, so gardening needs to be looked after. You know, cutting the edges and stuff like that.
We've been locked up forever. My missus has been in for 6 weeks, and all the kids, I've got 5 kids at home. They've been in. I took them out for the first time on Wednesday, up to Boolaw Park on the golf course, lick a walk around for an hour and then back. And that's the only time they've left the house.
So you just thought you'd come to the shop and get your paint?
Yeah.
Do you think people are just getting bored of lockdown?
Yeah, I would say that, yeah. I would say people are getting fed up because they've been locked out for a long time and people are getting anxiety, stressed. So I would say, yeah.
It's been 4 long weeks, hasn't it?
B&Q told us that, like other essential retailers, they've introduced strict social distancing rules and limited the number of people allowed in at any one time.
It's certainly been busy here this morning with queues of up to an hour. Some essential DIY jobs are so popular that they've had to form a separate line for people wanting to buy paint for the garden fence. There are also tradespeople here who tell me that they've decided to go back to work. So are we cautiously creeping back out?
This is Finsbury Park.
This was North London today. The streets certainly feeling much busier. We are, it seems, driving more. This week, roads have been 10% busier than at the beginning of lockdown. Weekend traffic is still slow, but during the week, it's travelling up.
What we do feel is some drivers have perhaps got pretty bored being locked up and they're starting to venture out a little bit more than they were maybe 2 weeks ago.
If it's quieter at the weekends and then busier in the week, does that suggest that it is all work journeys?
The government have actually been quite vocal, telling people not to go to Brighton Beach or the Lake District at weekends. But then when the week starts, I think people think, no, it's back to normal, and it is creeping up.
The Health Secretary said today he's comfortable with stores like B&Q reopening. But he also said it's too early for lockdown measures to be relaxed. But is this mixed messaging? With no end in sight and the government in Westminster refusing to publish its exit strategy, will people start to take lockdown less seriously? Darshna Soni, Channel 4 News, Nottingham.
Well, earlier I talked to Devi Sridhar, who's Professor of Global Public Health at the University of Edinburgh and an advisor to the Scottish Government. And I began by asking her if she thought the UK Government is now on the right track with their response to the outbreak.
Yes, I think it's really positive that yesterday we heard from the Health Secretary that the imperative was keeping daily new cases low and that they would be pursuing a test, trace, isolate strategy, which would enable the government to lift some of the harsher physical distancing measures. And so I think that's very positive.
So if you were in charge, when would you be thinking about starting to lift the lockdown? How far away from this are we?
I think we're actually a number of weeks away from it. I think right now, and that's just the realistic answer. I mean, I think right now we have a long way to go to get to the number of tests where we need to be testing. We need to be going beyond essential workers and healthcare workers and even just those who are symptomatic, because we know that they're asymptomatic carriers, and actually be looking at a pretty broad kind of community testing program to get a handle on actually who has this virus.
How much closer in truth are we to having a vaccine?
Well, I think on the positive side, we're already seeing the start of human trials and it being injected into people. But I think what people need to remember is that actually we don't have any vaccines against other coronaviruses. We still don't have a reliable antibody test, and we don't know much about the actual immunity protection from having had COVID.
You're one of the many advisors to the Scottish Government, aren't you? But we still don't know who is on this mysterious SAGE group of scientific advisors. How important is it that we find out who they are?
People need to understand where is the expertise coming from, who is actually giving it, and as much as possible offering that up to scrutiny from the public. The Scottish Government has released a strategy this week and trying to establish a very kind of grown-up conversation with the public about the tough trade-offs that are coming and about different principles. And two of the key principles it's committed to is first, keeping daily new cases as low as possible, because it is clear that from an economic and social perspective, keeping new cases low is our best hope of keeping that, running as smoothly as possible, as well as deaths from COVID and non-COVID related causes.
You tweeted over the last few days that, words to the effect of, when are the public going to wake up and realise what's going on? What do you mean by that?
I work in a cross-country comparative context. I'm a global health researcher. And if we look at where the UK is, we've had 45,000 excess deaths and within hospital, almost 20,000 COVID deaths. These are really high numbers. This is the second highest, death toll in the world to this. And, again, South Korea has had less than 300, Australia less than 100, New Zealand less than 20. I know these are all different contexts, but when you look across countries, the question is, what happened in the UK that made us have such a different experience? We've also taken the economic hit, and it looks like we're going to be weeks in lockdown, given we still haven't gotten the infrastructure to be able to lift it. And we've also taken a social hit. And in the end, this is lives versus lives versus lives. And so we've taken a triple hit, and I think that's going to lead to a lot of hopefully analysis and learnings on how, whenever the next virus comes along, that perhaps we can react faster and avoid being in this situation.
Bluntly, have we made a mess of it?
Because I'm a loud American, I guess I can say yes. I mean, I think if we had really, if I think back to February, March, I think the two critical moments were first, the lack of aggressive containment, that actually it seemed like this was treated like flu and we moved to mitigation too quickly, where we should have been treating this like a SARS or MERS-like event and actually aggressively containing it and building the infrastructure to contain it. And I think the second mistake was not to actually think about PPE for health workers and actually how do you protect our most precious resource in an outbreak, which is your frontline health staff, and making sure that they feel safe and they feel protected by the NHS.
Devi Sridhar, thank you very much indeed.
Thank you.